All right, we're going to go ahead and get started. My name is Gladys Godinez. I am a community organizer with the Center for Rural Affairs. I have loved working for the center. I appreciate everything that I've done through the center. It has allowed me to do a lot of good work within communities in rural Nebraska. I just wanted to start with housekeeping. Please let me know when you're here by saying hello in the chat box or the comment section. Please ask me questions anytime in the chat box. My colleague and partner in crime, Jordan Fireherm, will be sharing the resources as I talk about them so you can see them up close and save them to read later. This is an inclusive conversation. We are asking that you please keep it positive, and we are hoping that we can have this positive conversation where I can share resources with you and we can have a real conversation about language accessibility. So thank you again for joining us. All right, so again, my name is Gladys Godinez. I am from the Center for Rural Affairs. I work for the Center for Rural Affairs. I am a community organizer, and my emphasis is inclusion. So as you know, our title is Multilingual Resources in a Time of Crisis. We're currently in a crisis. COVID-19 is really hitting our rural towns very hard, but you also know that our rural towns are demographically changing. So we are fully aware that some resources may be lacking or not because of intention, right? But because of just not knowing that there's some resources out there. So my hope is that we not only focus on the problem, but also bring you some solutions and some ideas on how to help you help others that may be impacted by this pandemic. So Center for Rural Affairs was established in 1973 here in Nebraska. My office is in Lexington, Nebraska, and I just wanted to pinpoint that one of our values is fairness. That allows all who contribute to the nation's prosperity to share in it. So again, I love the fact that I can work for an organization that really takes inclusion as a priority, and I'm able to do that work here with the Center for Rural Affairs. We also do exist to build more vibrant rural communities. And again, my name is Gladys. So we'll go ahead and get started. My co-worker and partner in crime, again, Jordan Firearm, is in the comments section, and he will be sharing some of the resources that I'm talking about, some of the information that I'm talking about as well. At the very first is just let's talk about disparities. We have known that health disparities have happened within a lot of different communities throughout a long time, right? This is a systemic issue, and unfortunately, we are seeing it front and center right now. We are seeing the fact that a lot of individuals are being left out due to not having vital information that we're seeking. So NPR did a piece. It's called Disparities or Patients Are Affected by Health and Other Disparities. It's a podcast. I definitely recommend for you to go ahead and listen to it. Personally, I live in Lexington, Nebraska, and I know we have individuals from around the United States, so I just want to be respectful to that. But I am currently in the middle of the United States, Lexington, Nebraska. So we have 70%, approximately 70% the Latino population. Half of them speak Spanish at home. And then we have 10% of African and refugee population. And one of the reasons, and I'm sorry, they speak Somali, Sudanese, Arabic, all at home. So we want to be respectful of those individuals that are currently going through it, right? We want to be able to inform them of what's currently happening. Here in my community, we know that there's a need for multilingual resources. We know there's a need for communication between cultures to be able to better assist everybody within the community. And one of the reasons why there is such a diverse population in this small rural town is because we have a meatpacking plant. It's been here for a very long time. It's the lifeline, if you would say, of our community. So we are aware that we have a large, diverse, beautiful community, but we also know that we need information in various languages because, yes, culture, identity, it all comes with who we are, and language is part of that. I am Guatemalan. I speak Spanish. I am also an immigrant and Latina, and I really enjoy knowing that I have that Spanish language to lean back on because it has given me the ability to help others. There was an Omaha World Herald piece as well that had a piece on how there are some limitations in regards to um, access to health care. So we are seeing that a lot of the information is being shared, but if you're not, if our public health departments, our Department of Health of Human Services, or our government entities are not sharing it, then a lot of people are being left behind in regards to very vital information. So I want to give a shout out to the Minnesota Department of Health and Human Services, California Department of Health and Human Services. They are doing awesome work. Nebraska, I know that they're working to be able to get that information out in different languages. Today, actually, in the state of Nebraska, the governor is going to be doing his very first press release or press conference in Spanish at 5 o'clock here Central Time. So follow Pete Ricketts, Governor Pete Ricketts, for uh, a Spanish piece. We're really excited that individuals, government entities, and public health departments are looking into getting this information out to the individuals that really need it the most. Now, I know you're here for resources, so let me go ahead and give you some. CDC is a national website, right? Center for Disease Control. They are they are working really hard. Initially, they had some information, but it was not a lot. Now you can not only find Spanish, but you have other languages that you can find information on. And the really cool thing is that they have graphics, something within the Latino community and other communities of color. We love graphics. So if you're going to be doing any multimedia post, make sure that you have graphics, you have pictures, attention grabbing information. Some of our populations are from the Latino community are Indigenous. So we are aware that the only way that they can communicate, some can communicate, right, is vocally. So verbally, it has to be something that you speak into. So make sure that if you do some information, I know we're all limited in capacity, but if you have somebody that's able to share that information via video, it would be completely appreciated from those populations. Um, so one of the resources obviously is CDC. The other one is partnering with local nonprofits that have access to multilingual individuals and or employees. And you asked me who exactly would be that person. Chances are you have local nonprofits throughout your states. But the one that is currently very active in doing multilingual resources here in Nebraska, the state of Nebraska, is Lutheran Family Services because they do a lot of refugee resettlement. So if you can follow reach out to your nonprofits, chances are they are more than willing to help you in regards to getting information out. So partner up with those nonprofits. I know we've been seeing the need and the lack of communication throughout, obviously, and hence why we're here. But reach out to your nonprofits, specifically resettlement nonprofits. They may have the ability to help you do a video in the language that you're seeking, and or nonprofits that are there to help refugees and immigrants from each community. So if you have any questions specifically to any state that you may be looking for a specific nonprofit that reaches out to refugees and immigrants in various languages, you're welcome to reach out to us. Again, Lutheran Family Services in Nebraska has done videos in various languages to be able to introduce COVID-19 and better practices in regards to how to reach out for assistance. The next one, the other resource that I want to give you is hiring and compensating interpreters. So this is vital, right? If you have the funds, which we all know we're struggling, a lot of nonprofits are struggling with, but if you have the ability to hire an interpreter, look for your state's website on your Association of Translators and Interpreters. Specifically here in Nebraska, we have the Nebraska Association for Translators and Interpreters. They have a listing of interpreters from various languages, including English, Somali, Arabic, and those are some of the main languages that we're seeing, at least in rural Nebraska. We know we have other languages in Omaha and Lincoln. So here in Nebraska, again, the Nebraska Association for Translators and Interpreters, reach out to them, look into their website to see what resources that they have. And then lastly, a lot of entities have access to language lines. So please utilize those if that is your last recourse, if that is the only way that you can reach out to interpreters. They would be the ones that we would refer you to in regards to getting that information out in all languages. So again, those are my resources at this moment. We are working together to be able to get get a blog and some resources on our Center for Rural Affairs website. So please be on the lookout for that. We do plan to do that within the next week. And it will have more resources, more videos. I do have access, and I apologize, I don't have the link for that at this moment, but we do have access to some Guatemalan Indigenous videos where they explain what COVID-19 is. And I don't know if you were aware, and I just learned this, and again, I'm from Guatemala. There's a lot of indigenous native languages in Guatemala, and we have in Nebraska we have a lot of indigenous populations in our state. So it is one beautiful that we have the diversity, but two also makes it enhances the barriers, right, to be able to communicate with individuals. So that is the resources that I currently have for you. I did want to share with you, just a brief story. When I was young, I I came to the United States when I was 7. We, my brothers and I, we learned English. We were the first to learn English in our community, in our home. So then we became those interpreters, right, at a very young age for our family members. Something that you have to keep in mind that even though, yes, it is awesome that the children are interpreters, sometimes we're put in places where we should not be having those conversations. So if I may request that if you are seeking interpretation, that you seek interpretation from adults that have a cultural sensitivity and understanding of those cultures, because it is so important to not put a child in a place where they, one, may not know the jargon, and two, it is such a sensitive topic, right, to be able to talk about conversations that are health related or life and death related, or just, let's say, immigration status related. It is really hard for us as kids, when I was a kid, to be able to interpret. I loved it. It gave me a lot of experience. But if we have the ability and capacity to be able to pay for an interpreter, to have them be present, to be able to communicate that information, then I would suggest for you to be able to hire somebody and or seek a volunteer that is an adult and can help you meet that need. So that is what I have. Any questions that you may have in regards uh, to multilingual resources, please reach out. I see you, Carlos. Thank you very much for joining. Teresa, thanks for joining. Alma Munoz, I appreciate you coming and joining us today during lunchtime. Again, any questions that you may have, please post them on our comments page. That's why we're here. We know the need is out. We know that you are seeking, the reason why you're here is because you're seeking resources. So we want to be that for you here at the Center for Rural Affairs. So I appreciate you. I'll give you a little bit more time to post any questions that you may have, but if not, please keep a lookout for that blog and some resources on that page. Again, it should be coming out within the next week. So if we don't have any additional questions, then I think we're good to go. Jordan, thank you for joining me, partner in crime, in doing this Facebook Live. Again, such a necessary topic, and treat us as a resource to be able to give you some insight and some resources on how we can help you in reaching out to your multilingual populations, and how getting that information is so necessary. So thank you again. Have a great day. Take care. Please take care and be safe. All right. Bye.